My name is Monique. I'm an admissions representative at National Holistic Institute, a college of massage therapy. Sean is one of our talented instructors here at the Sacramento campus, and he's going to give you a small sample of our comprehensive curriculum.
Thank you, Monique. Today we're going to be talking about carpal tunnel syndrome. We'll address some of the issues that clients may face as far as the symptoms. We'll talk a little bit about the anatomy of the carpal tunnel, and as well as how we address these issues with our massage therapy techniques. So here you see the kind of an overlay of the skeleton of my arm. The carpal tunnel is found right here between these carpal bones. And what's happening here is the musculature comes down from the elbow, the flexor compartment of the wrist and forearm. The muscles, the tendons of the muscles travel through this carpal tunnel, as well as a median nerve. And as these muscles get overused, then they tend to swell up a little bit, become inflamed, and compress down on that nerve. And that's what causes the client to have the tingling, numbness, or pain sensation in their hand. It's really characterized by a lot of numbness in the hand. It causes a lot of discomfort for clients. So to address these issues here in the forearm, we're going to be working on the wrist and hand and finger flexors. Those muscles travel from the wrist, hands, fingers, all the way up the forearm, connecting just above the elbow. So the massage techniques we're going to use is going to be a little bit of warming to start with. These can be compressions, S strokes, or C strokes, a soft fist, anything just to warm up the muscle, get some blood flowing, circulation increase to the area. It's also going to help her accept a little bit deeper work that we're going to be delivering to these muscles. So once you notice that the area has gotten a little bit of extra color to it, starts to turn a little pink, little red, we're ready to carry on with this work. Okay. As we work, what we're trying to do here, we're trying to accomplish is to lengthen these muscles a little bit, relieve some of the pressure on the tendons going through the carpal tunnel. This is going to decrease the amount of pressure that's being put on the nerve and ultimately decrease some of the symptoms that the client is experiencing. So I'm going to start down close to the wrist. It's mostly tendinous material here, so I'm going to come up where it's a little bit more musculature and begin sliding long strokes up the forearm. Nice, slow, lengthening strokes. How does that pressure feel? Is that okay? Mm-hmm. So as I approach the top of the elbow, I want to avoid the cubital fossa here. Can cause some clients some unnecessary pain and nerve damage there as well. So the idea here is just to loosen these muscles up, again, decreasing pressure on the median nerve. I'm also trying to increase the overall circulation to the lower arm, the wrist, in hopes that that will bring more blood to the area, more oxygen, and increase the rate of healing in this repetitive use injury area. So another technique I can use to lengthen these muscles is a pin and stretch technique. So what I'm going to do is bring the wrist into flexion here, soft fist into the musculature, and as I slide up through the muscle, I'll let that wrist come back down into extension. This is a really good stroke to go very slow with. The client can feel a lot of sensations here if you go too fast. By that I mean some pain. So we want to decrease that.
Thank you for watching. I trust that you benefited from this information. If you would like to learn more about a career massage therapy, I invite you to come and visit one of our 7 California campuses. You can observe a class or speak to one of us today. So you may contact us by calling toll-free or visiting us online.